Good afternoon and welcome to our conference today entitled Respecting Personal Choices, Engaging Communities in Advanced Care Planning. My name is Brandon and I'll be your operator for today. At this time, all participants are in a listen-only mode. Later, we will conduct a question and answer session. Please note this conference is being recorded and I will now turn over to Yadao. Please go ahead.
Thank you. Thank you so much, Brandon, and thank you everyone for joining this very important webinar today. I appreciate your participation because we've got some great information and great speakers. So I'd like to, without any further delay, introduce our first speaker. You may know her, Kate DeBartolo. She is the National Field Manager for IHI, the Institute for Healthcare Improvement. She's worked with them since 2007 and currently leads both the National Field Team at IHI as well as for the Conversation Project. And her work on the Conversation Project began in April 2013. So we're very fortunate to have her today and to tell us about the Conversation Project and the community engagement that's happening throughout the nation. So thank you, Kate. I pass it over to you.
Great. Thank you so much, Joy, for having me. It is great to chat with you all. As Joy mentioned, I've been with IHI since 2007, so many of us may have worked together over the course of various campaigns, 100,000 Lives campaign, 5 Million Lives campaign, Project Joints, but my work now has been transitioning to an initiative around end-of-life wishes, and we've taken a lot of what we've learned at IHI about large-scale engagement and applied it here to the Conversation Project. So my hope is to really share with you a bit of background about the initiative, just as a kind of taste or teaser, and to let you know, give you my contact information if you want to follow up for additional information. But the first thing that I want to share with you is just what the Conversation Project is. It's a large public engagement campaign dedicated to ensure that everyone's end-of-life wishes are both expressed and respected. And I think it's important that there's two sides of that. One on the express side of how we engage the general public so they can have the conversations, and another about how, as healthcare system, we can respect and receive what those wishes are. So we know from our work that there's a pretty big gap right now, that about 9 out of 10 Americans agree that this is something they should be talking about, they think it's important to talk about, but fewer than 30% have. And so our goal here is to help shrink that gap. One of the reasons we've been trying to do that is we got a lot of feedback from the healthcare system that we need help from the outside in, that we've been trying to move the needle on this within healthcare, and it's moving so slowly, and we need more families and patients to come into the setting having already had these conversations. I want to be clear that we have no kind of position on what somebody's wishes should be. Whether you want to receive, very exhaustive measures and a lot of care at the end of life, if you'd rather be at home with very little care, or plenty of care but not much treatment, then that's fine as well. We just think that it's important for people to be having these conversations early and often, around the kitchen table before there's a crisis, because we know that that's a terrible time to learn. And that our emphasis here is really on understanding how people want to live at the end of their life. I include this image here because I think it's really helpful for figuring out what it is we're talking about. When we talk about somebody's end-of-life wishes, it's important to talk about this when somebody's healthy, when they've maybe been diagnosed with a chronic illness, and again, as they're approaching the end of life. For now, I think that a lot of people, if they have the conversations, they tend to do it only at the approaching end-of-life side of things, but we know that it's important to kind of expand this, and we would love to see more time kind of spread across. And in the orange here, you'll see what we think is important about expressing wishes. So at the Conversation Project, we see ourselves far over to the left. How do you get people even talking about this and breaking that social taboo, then getting it documented, and then working within the healthcare system to kind of receive, record, and respect what those wishes are. So there's a large continuum, and what I'll be sharing with you today is a bit more on the express side, but we also have a lot of information for how healthcare systems can steward that information and respond to it properly. As I mentioned, we have this kind of idea of almost a double helix of social change, if you will, working with the public to build awareness as well as with the health system so that this can come together. And many of you may have heard this framing of shifting away from what's the matter with you medicine to what matters to you medicine. And I think this is particularly important as we think about it towards the end of life. So for the Conversation Project, we've got 3 goals. The first is to just generally build awareness about the importance of this initiative or the importance of having these conversations. We do that through some large media campaigns, PSAs, articles, all different websites that we have, and additionally to help build tools to help people get started. So we've got a very popular conversation getting started guide, how to have a starter kit so that if you decide that you want to have the conversation, we have tools to help make that easier for people to do. And then also to learn how to bring this to people where they work, live, and play. We've seen amazing interest from different regions who want to start introducing this in their community, and so that's what's the third principle of our work. So as I mentioned, building awareness, we've had some wonderful media opportunities. We've got a lot of great videos on our website. The Conversation Project was co-founded by Ellen Goodman, who's a Pulitzer Prize-winning columnist from the Boston Globe. And so it helps that whenever Ellen writes op-eds in the New York Times or Good Housekeeping, that it tends to get syndicated across the country. So that helps us build awareness. I mentioned some of the tools we have. We've got our Conversation Starter Kit, and we have that in many different language translations as well, along with a 1-page summary that people can use for their medical records. We've got a How to Talk to Your Doctor Kit, one for parents of seriously ill children. This is one that we created after getting feedback that folks would like some help with that, as well as one that we're working on right now for patients with dementia and Alzheimer's disease, how to help patients and particularly the family members and caregivers to address what somebody's end-of-life wishes would be. So all of these tools are freely available on our website. And then, as I mentioned, kind of reaching people in the community, this is a map from a recent call that we had that I love from working with different community groups all over the country and internationally, of individuals who said, I want to bring this to Cincinnati, Ohio. I think I know, who I should engage in the region, which is going to be different than who's being engaged in Dallas, which is going to be different than who's in Seattle. And so all different types of people and organizations, some are healthcare organizations, some are not, who have expressed an interest in kind of translating this, if you will, into their local setting. So we've been working with different companies, actually. There have been employers who've been introducing this to their staff. We've got Goodyear Tire and Rubber Company gave out, about 25,000 starter kits to their employees. A lot of employers who are realizing that this is something that's really important to their staff. Many people are caregivers when they go home and helping them feel comfortable caring for a loved one. We've got health systems who are introducing it to their staff as well. We've been working with different congregations and houses of worship around the country who are introducing this in their region. So you name it, we've got people who are bringing it to local prisons, to the news channels, to libraries, hosting Final Friday afternoons to bring this up. There's pretty much, there's been so much excitement about the topic, and it makes sense that it applies across many settings. Death is not just a medical experience, it's a human experience, and I think people are starting to pull that back. So when we're doing this work in the community, we're seeing local leaders start to get involved. They're hosting presentations, doing train-the-trainers, going to different assisted living facilities or Chamber of Commerce who want to introduce it. There are a lot of employers who are introducing it either as part of the HR onboarding process or maybe doing brown bag lunches. Definitely health systems we've seen in Memphis where they said, we want more people to be having a conversation in Memphis. Why don't we start with the 10,000 hospital employees in the city, introduce it to them. If each of them has the conversation, it'll continue to grow. Or similarly, at this time of year, the work at Beth Israel Hospital in the Boston area, where they're doing a big Talk Turkey campaign for all of their employees before they head home for Thanksgiving. How can you get materials you would need to have to get a healthcare proxy or to start having the conversation? So a lot of neat ways of engaging people within the employer world. And then, as I mentioned, the faith side, we just finished last week a big conversation Sabbath in the Boston area where more than 40 houses of worship got together to each preach or teach about the importance of the conversation. And it's been really exciting to see different leaders sharing sermons or agendas for how to kind of integrate this into pastoral care. Has been really exciting to see. So I just wanted to take a moment to share with you examples of what some of the materials are and have included in them. so that you can be familiar with it if you want to speak it out. The first thing we do in our starter kit, which somebody can fill out on their own or have as part of a conversation, is to really think open-ended, what matters most to me at the end of life is. And then to, just make the note that we see all different types of responses on this. It can be everything from kind of cheeky about dancing with 90s music or wanting to be in a hospital with excellent nursing care. We see people who talk about wanting to be with their family or with their favorite pet. And, this is not really a medical question. It's about what matters most. There's a woman I met in St. Louis last month who said the most important thing she could think of right now is that she hates to have her feet tucked into the sheets. And she thinks her loved ones know all about her medical wishes, but she realized she must tell them that. So if she can't speak for herself, nobody's tucking her feet in. So whatever it is that matters most, people can include that. And then they can go through a series of questions on a scale of 1 to 5. And I think for a lot of people who don't know what we mean when we say end-of-life planning or advanced care planning, it can be really helpful to see questions that are not immediately medical or legal in nature. So this is not, do you want feeding tubes or resuscitation? It's more on a scale of 1 to 5, are you more concerned that you're going to get too much care or too little care? And getting people to kind of figure out where their values are, these are the conversations that are really helpful to then have with your loved ones or your providers, because there's no way we could possibly go over every single hypothetical scenario that may play out. But we can start to understand what somebody's values are, and that's what we try to get through. As well as to let people then make plans for who it is they want to talk to, when they're going to do that. We give some icebreakers, help people kind of introduce the topic to loved ones. And we do all sorts of trainings for people. So we do speaker training. We've got another one coming up in January that's free if any of you would be interested in joining, about how to introduce this with people. And I thought that I would share a few tips that have come up in the course of this, where we really encourage people to tell more than one person what your wishes are. That there was a woman who I met in Florida who said she realized she had spoken with her husband about this, but they had never told her stepchildren, and how difficult that would have been if they became upset when she was making decisions for their father, not realizing that it was based on conversations they've had. So sometimes, even if you don't need to have the conversation with everyone, you can at least let them know who else it is you've spoken to. Similarly, the importance of having two conversations. I have a conversation with my husband about what I want, but I also then follow up with him about what he wants, or with my mother about what she wants. And so there's multiple conversations that can happen. And I think that two others that really stick out to me. One is this idea that maybe many of you have seen, where when people say that they wish to die at home, but that's not always feasible, either financially or physically or for a variety of reasons that may not be possible. And so we really ask that they try to unpack that a little bit, learn a bit more what is it about the idea of home that's most important. I know that I was working with teams in New York City where it's very difficult if somebody's in a fifth floor walk-up to have their aging grandparent live with them at home. But let's find out, does that mean you don't want to be hooked up to a lot of machines, or you want to have music playing and have your pet with you or have visitors, and kind of understanding what people mean from that. I wanted to share a couple of the tough questions that we get in case they come up for you as well as you get through this. One of them has been particularly, I think I want to address at the bottom here about death knells, because I just got off a phone call. For any of you who are familiar with the term, this was around the idea of Medicare reimbursing physicians for conversations with their patients about what they wanted at the end of life. So there's a lot of political brouhaha for a few years about that. And just a few weeks ago, Medicare now has passed the payment plan that they are going to reimburse for this. It's going to go into effect in January. And so we've just started to have all of these calls about what that means for people. And I think that there actually has been way less kind of fear about these conversations, but an understanding that if you are concerned that somebody else is going to make decisions on your behalf, it is all the more reason to be having these conversations with loved ones. And similarly, around the physician-assisted suicide, questions that have come up as a lot of different states have been exploring different legislation, especially after the popularity or the viralness of the story of Brittany Maynard, a young woman in California who moved up to Oregon. That, as I mentioned, we do not have a position on what somebody's wishes should be, but I think Ellen did a nice job at a piece where she was talking particularly about the Brittany Maynard case, But it's too bad, actually, that the conversation in that story became so much about the physician-assisted suicide, when really, because there's so few people who end up in a situation like that. But what really was amazing is here was a young woman who had had conversations with her family and loved ones, so they knew exactly what it was that was important to her, and they were able to act on that. And that's something that the 9 million people in the course of the week who shared the story really could take to heart and take home with them. So we try to encourage those types of conversations. As I pass this off, I just wanted to make sure you're aware of some resources that we have available. The first is a free IHI open school course for any providers who are interested in understanding better how they can have the conversation with their patients. We have a course that we're going to be doing in January as well, especially with this new reimbursement structure that's come out to help people understand how they can do that. We have a white paper that I'll be sure we send out with the notes as well about the role of health systems on being sure that we actively receive, record, and respect what these wishes are. If I do my job and get everybody in the country to be having conversations about what they want, we need to then figure out how we can respect what those wishes are, and we've been doing a lot of work in that area. And I want to invite you to the website. We've got a lot of different tools and materials there, including a whole community resource center now. If you're interested in introducing this in your region, you don't have to start from scratch. We've got a lot of examples from around the country over the last few years, so you can build on the work of others. And similarly, you can join us. We have monthly community calls with different regions who come together to share the work that they've been doing or ask questions. And as I mentioned, we do a free speaker training call, and our next one is in early January. So this was meant to be just kind of a teaser of all of the things that we're doing in the Conversation Project. We've got, 250,000 downloads of the starter kit and a lot of really exciting energy happening. And so I would love to chat with any of you if you're interested in bringing it to your community. We're in hundreds of communities around the country, so I've included my email address here if you'd like to follow up. With that, I want to turn it over to Joy. I don't want to steal too much time from other presenters, but if there's questions, I'd be happy to answer them as well.
Thank you so much, Kate. That was just so thought-provoking and oh my gosh, it just opens up a lot of possibilities for having good conversation. Does anybody have any questions? Or Brandon, would you like to give some instructions on questions?
Yes, thanks, Joy. We will now begin the question and answer session. If you have a question, please press *1 on your telephone keypad. If you wish to be removed from the queue, please press the pound sign or the hash key. If you're on a speakerphone, please pick up your handset first before dialing the numbers. Once again, if you have a question, please press *1 on your telephone keypad. And we're standing by for any questions.
I should mention while we're waiting for questions that sometimes I do this presentation in 6 hours where we go over all sorts of tools and resources. So I realize kind of the wind blows back in people's hair a bit to hear it. I just wanted to make sure folks had a taste of it so they can follow up on the pieces that are most intriguing.
Okay, it looks like we have no questions at this time.
Great.
Can we queue up the first polling question then? We do have a polling question to find out if in your state, do you have forms like POLST or MOLST or something similar to that? Are you familiar with that? Do you have something like that in your state? Okay, I think the time is up on the question. And we're just waiting for results. There we go. We've got 54 yeses and 23 noes. So it looks like the majority is aware of this and has it in their state. So that's a really good movement across our country. So are there any questions for Kate?
Nothing on the phone.
Great. I guess you did a fantastic job, Kate. Thank you so very much.
Thank you for having me.
And now I'd like to introduce our second speaker. Michelle Cantillo is the Advanced Care Planning Coordinator for Hawaii Pacific Health Patient Safety and Quality Department. She's been there since 2011. In this capacity, she has oversight responsibility for development of ACP programs at 4 different hospitals here in Hawaii. She's responsible for teaching the POLST facilitator training at all 4 facilities as well as community organizations. Prior to her work as ACP coordinator, Michelle practiced for 25 years in med-surg nursing, primarily in the area of critical care. Michelle began her nursing career in Toronto, Canada, and came to Hawaii to continue her experience at Straub Clinic and Hospital. And she was Straub's ICU supervisor and manager for 12 years before transferring to the Patient and Safety Quality Department. So quite a wealth of experience, and I really appreciate having her here today. So Michelle, I pass it to you.
Great. Thank you, Joy, for inviting me to this great presentation. Kate, thank you so much. Great. I see my slides are up. Awesome. Yes, I have a lot of years of experience, and so my role since the last 5 years is promoting advanced care planning throughout Hawaii Pacific Health. You can go to the next slide, please. So Hawaii Pacific Health, we have 4 hospitals, 3 in Oahu, the Kapilani Medical Center for Women and Children, Palimomi Medical Center, which is an adult center, and Straub Clinic and Hospital, which is where I did most of my critical care nursing and managerial experience. Wilcox Memorial Hospital is in Kauai. Next slide. This is just a quick general information about our facility sites. So what I'm kind of going to go through is basically what we have done to implement advanced care planning at our hospitals and how we have helped to spread it to the community. This is general statistics that I believe everybody knows. 7 in 10 Americans die from chronic diseases. We know that 32% of Medicare is devoted to spending with our patients with chronic illness in the last 2 years of life. This is all from the Dartmouth Atlas. And as Kate mentioned, you know, where does people want to die? Many people want to die in their homes, but over 80% of the people die in our hospitals. Many of our patients don't have advance directive on their file, much less alone POLST. When I started in 2011 in this program, we had 9 POLST documented in our system. Next slide, please. This is specifically from the Dartmouth Atlas in 2010 data, where for Hawaii specifically, you can see as a hospital's place of death, we ranked 2nd worst following New York. So compared to the national average of 25%. So obviously we have room to grow and work. Next slide, please. The previous one. And the hospital, okay. I guess there were 2 slides. One got missed. Anyway, there you go. Hospital utilization. We need work to do in terms of our hospice referrals. We're the 6th worst state. 35.6% is their average compared to the national average of 47.5. Utah ranking the first of top 5 states of 60%. So for us, our hospice referrals are really done really late, usually within a week of discharge where our patients are getting hospice referrals. Next slide. So within our program, we have looked at advanced care planning. What we want to do is just, as Kate mentioned before, we want to make sure that advanced care planning conversations happen. We know that it's not a one-time discussion. It happens in stages. It needs to start at the home first, in the public, before you come to the physician, then to the hospital as they transition out to the continuum of care, whether it be the hospice, long-term care, or community services. And we want to make sure that our advanced care planning is documented, that we can understand it, our documents are accessible, and they're honored. Next slide. So this is a slide from Respecting Choices, and we joined La Crosse Gunnison Lutheran Respecting Choices back in 2011. And one of their, what they've done is looked at the first steps, next steps, and last steps. This is advanced care planning over a lifetime of adults. So here's a chronic trajectory of a chronic patient in and out of hospitalizations. So our first steps are basically for us, all healthy adults who have not had any planning. We need to all start that. And then the next steps are the chronic patients with progressive life-limiting illness. And then the third one is the last steps, or we call it here at HPH when we started in 2011, last stages patients. So there the surprise question. Would you be surprised if this patient died in the next 12 months? And at HPH, this is where we have put our last efforts within the last 5 years looking at the last steps or last stages patients. Next slide, please. So our goal is basically to communicate these, provide a mechanism for these seriously ill patients for these end-of-life treatments across our care settings, and making sure the implementation of our ACP planning is done and it's very specific for those specific patients. Next slide. So again, this slide is where we're respecting choices. And so what they have encouraged us to do as an organization is making sure we go through our system redesign. We make sure we do education and facilitator training. Number 3 was community engagement. And 4, make sure we do measurements in the quality department. Next slide. So in terms of the system design, for you within your organizations, you have to know what do you want to implement within your system. For us at Hawaii Pacific Health, we actually include 5 documents that we have medical record scan. The Advanced Healthcare Directives, Live and Will, the Healthcare Power of Attorney, and sometimes we still scan also the Durable Power of Attorney, or POA, because some of our patients don't know which is a healthcare power of attorney. They don't even know which is this their Advanced Healthcare Directive. Also, we also scan the guardianship, the surrogate, and the POLST. And it's good to hear that from the last poll that many of you guys have POLST within your state. Next slide, please. So within HPH, what we've done is I've worked closely with our medical department. And what we've done is make sure our documents really were scanned after discharge. This doesn't help us while the patient is in hospital. It wasn't accessible, so we had to provide visible access. And our medical department agreed to scan all the documents within 12 hours of this patient, 24 hours the patient arrived. As well as that, they also agreed to have a standard fax number. I know that the slide is not very clear, but there's a process in place where anybody can scan it to fax it to this medical record numbers at all 4 sites, and within the 24 hours, medical records will put it in our EMR, which is our EPIC system. Next slide, please. Here's an example of our axis of advanced care planning storage and retrieval. So you can see in the upper right-hand corner in our EPIC on the snapshot, all the advanced care planning documents are noted there. The blue links, we can easily pull up the scanned documents. On the upper left-hand corner, under the patient's name, if a patient has POLST on file, we have the POLST received in the patient's EPIC banner. So that alerts all the clinicians as soon as our patient comes through the door, they need to open up that POLST receipt, open up the link, and they have a copy of this latest, only the latest scanned document. All these documents live in the chart and in the media, so there's a history of all documents. And then in the bottom left corner is a problem list. Those are where we encourage all our facilitators and our physicians and our nurse practitioners to make sure they document advanced care planning discussions. And as we mentioned before, this happens over time, so we can see the course of what happens in the patient's conversation. Next slide, please. So within your organization, know who your team is. How can you refer? Who will be your champions? Who can do advanced care planning? What are their roles and responsibility? What is their workflows? What other resources can you use? Next slide. So one example that we've done is making sure for her advanced care planning team, this is an example of an advanced care planning order set. So basically, when a physician goes on and says, okay, we have advanced care planning videos, and I apologize, the slide is not very clear. But basically, a physician can say, okay, I need this patient to look at this advanced goals of care video. Once that's ordered, automatically it links into advanced care planning consult. The advanced care planning consult goes to our social workers. They're excellent they're all facilitators, and we know they do an excellent job of this, as well as our nursing staff gets the order for the advanced care planning video education, so they can get the ball rolling up front. Next slide, please. Okay. Oh, we have another delay with the next slide. Okay. So I'll continue on. The advanced care planning team we have, okay, there we go, consists of chaplains or social workers, physicians, nurse practitioners, anybody who's basically have a passion for these end-of-life discussions, because we know that not everybody is comfortable doing this, and we want to make sure we do a full-on education. We have a full 8-hour course, 8 hours. You can see on the top, on the purple bar, we have 145 non-HPH members, facilitators. And what we've done is, this is a free event, and we have invited the community, long-term care, other disciplines to attend, because we recognize that advanced care planning doesn't stop within our doors. We need to go out and educate our colleagues in the community as well. Next slide. Community engagement is also very important. We have done advanced care planning workshops in our organizations. We've attended senior fairs. Recently we went to the AARP. We've done the senior fairs at our community. I go to the networks all around the neighborhood. HPH does a huge community service, like 4 events a month, year, and they have about 800 people attend. So last Saturday we had Women's Way to Health, and one of our discussions was serious illness. And again, educating the staff about advanced directive POLST is very important. And again, working very closely with our long-term care, the nursing homes, the assisted living, the hospice services, etc. Jeannette is going to talk later about Kokua. We work very closely with them because we're leading the way in terms of making sure education is done throughout the state. And the videos I mentioned before, we use advanced care planning decision videos. And thanks, Kate, with Kate's help, we're starting to use the Conversation Project. I've started to use it in some of my classes that I teach to the new grads, the ER grads, etc. Next slide. Community engagement, materials and tools. I work closely with Jeannette in terms of redoing all the Kokua tools, which is available to the public free and for clinicians. At HPH, we've done a video on advanced care planning, so it's open on our website. And it's basically trying to start the conversation. Getting the conversation that is important. Within all of our patients have access on their TVs to a patient education library. So advanced care planning videos are also loaded onto there. So a patient could maybe go scrolling through and pull up advanced care planning and go through the videos, as well as if a physician has ordered, they could see it on their TVs. We have ME videos, and we've started to use the Go Wish cards, as well as, especially at our children's hospital, they've used My Wishes for the pediatric kids in terms of their end-of-life discussions. Next slide, please. So the next goal is a continuous quality improvement, making sure within your organization, how do you know you're succeeding? Make sure who can do the data collection and analysis, reviewing the workflows, processes, and making sure we're honoring the healthcare decisions for our patients. And most of all, leadership involvement is crucial from the beginning. Next slide. So here's some stats that I have put together since we've started the program in 2011. So this is just raw data, an amount of pulse scan that we have within our organization at Hawaii Pacific Health. You can see the number have grown specifically within the last year as more with our insurance plans, they're encouraging our PCPs to do advanced care planning for our 75-year and older population. So on the clinic side, more ACP discussions and implementation is happening. So you could see that drastic growth back in Q4 of 2014. Next slide. This is an example of Kapilani, or Women and Children's Center. So we know that it's not only about adults and the aging population, it's for our kids who are, unfortunately, they're going home on a ventilator. They're going home with trachs. They're going home with long-term tube feeding. So this is the pulse implementation of how many kids are we doing as they leave our doors, exiting with pulse and file. And for them, as our women's children, they're mostly done by the palliative care team. Next slide, please. More importantly, are we honoring the pulse wishes honored? So back in 2014, we started maybe in 2013, but we started gathering data in 2014 saying, for our physicians, we want to make sure that you are looking at all our pulse for all patients that I mentioned come through the door within 12 hours of our arrival. And we're above 90%, and our goal is 100% within the last year-to-date, 2014 and 2015. The little bar in the corner is basically we have a best practice alert in our system for the physicians. When the patient comes in with pulse, it says, hey, the patient has a pulse and file. You need to open up the pulse and review it with your patient, and if they can't speak, their family or their healthcare power of attorney within 12 hours of admission. Next slide, please. So I mentioned earlier, last stages patients are a specific set of patients that we look at HPH, and we've been following them over the last 5 years. We have a registry for them, and they are basically the patients who have limited resuscitative orders, such as DNR, or elderly patients, 80 years old, admitted twice within the last 6 months, or patients who are 90, and all our patients who are discharged to hospice services. So our goal is to make sure that they have some kind of advanced care planning documents when they leave our hospital, as well as more specifically POLST. So you can see within the last 4 years for ACP documentation, we're the last in 2015 year to date, we're about 85% where they're getting some kind of documentation on their file. And more specifically, across the system, about half of them have POLST in their charts. The bottom numbers in 2015, I also look at all those patients who died. And of all of those patients who died, 60% really have had advance directive of POLST at time of death. And then many people always say, oh yes, the family always changes the POLST at time of death or even before. So I kind of look at that data for 2015 and noted that, only 4.5% of our families are changing the patient's designated directives, and of those, only 0.7% of the patients themselves have changed their own directives on admission to the hospital. Next slide, please. So this slide is thanks to Hawaii Health Information, HHIE, as well as HMSA, who provided this data from 2007 to 2014, showing as a state, this is where we're moving, and we're moving in the right direction. Percentage of deaths occurring within the hospital is decreasing to about 28% in 2014. So as a state, we are making some movement towards end-of-life care. Next slide, please. And that's it. This is a part of my team. I'm on the top upper left-hand corner, and this is one of our ACP training that we've done on site with some of our staff, a social worker, an ICU nurse, and a telemetry nurse. There's my information below. If you guys have any more information, you can email me or call me at my number. Thank you.
Thank you, Michelle. That was really great. Good examples of how moving the community in the right direction, and what happens when they actually end up in the hospital, so that we can honor their choices. Excellent. Do we have any questions?
And once again, if you have a question, please press *1 on your telephone keypad.
Also, if you have any comments about what's happening in your community, are you experiencing similar situation as Hawaii, or maybe you have some ideas to share too? Feel free to either chat, enter them in the chat box, or to get on the line for comments.
Okay. And from Jefferson Community, we have Judy McGee online. Please go ahead.
Yes, thank you. That was just excellent. I was wondering if Michelle would be willing to share her slides. There were several in the introductory information that had the three levels, the well people compared with the people that might be expected to have problems within 12 months. I think that would be very helpful.
Yes, definitely. I believe the slides are already shared, but yes, most definitely.
Thank you.
There is a part on the WebEx where you could get the slides, but otherwise from your QIO representative, we'll make sure that you get them.
Okay. And once again, if you do have a question, please press *1.
Otherwise, we have, thank you so much, Michelle. Really, really appreciate all that information and everything that you do in Hawaii. I've got to say that, single-handedly, Michelle has really gone out there into the community and helped stimulate people having these conversations, and we really appreciate you.
Thank you.
We have a polling question now for you regarding your advanced care plan. Do you have one? So if you're willing to share, and if you don't, if you have one, that's great. That's what you're supposed to do. But if you don't, if you're like many people who don't, what are the reasons why you have not completed this yet? So you can take a look at that polling question. And I believe the time is already ticking, so go ahead and put in your response. Okay, the polling is closed, and I'm anxiously awaiting to see how many people haven't done theirs yet. They say that healthcare professionals are the worst. We make the worst patients, and we don't do our planning very well. So it looks like the majority of us do not. Those who answered, we've got 51 people that do not have a plan and 35 that do. And the most popular answer is, I just haven't gotten around to it. And that's, typical human behavior response. Just, I'm meaning to do it. I know it's important, but I just haven't gotten around to it. And some people did respond, 8 people did respond that, I'm too young. I don't need it right now. And that's cool. That's fine. But now you have the information and you know where to go to start having those kinds of conversations. And in my opinion anyway, you're never too young to just start talking about what's important to you in life. So great response to that. I appreciate it. And thank you again, Michelle. If there are any other comments or questions about any of the presentations, I'll make sure that they get to the right person. So now, let's see. We have Jeannette Koijane. Jeannette is the Executive Director of Kokua, which is Hawaii's hospice and palliative care organization. And she's worked with this organization for over 14 years. Beginning while she worked at the Executive Office on Aging. She received her graduate degree in public health from the University of Hawaii and her undergrad degree from Cornell. She's been involved in the field of hospice and palliative care for over 24 years. I guess she was only, 10 or so when she started. Beginning in the field of HIV and AIDS, working with the AIDS Memorial Quilt as the Director of International Programs, and then in a variety of research and educational positions. Jeannette has worked with the U.S.-affiliated Pacific Islands, helping to develop palliative care programs through a collaboration with the UH Cancer Center and the John A. Burns School of Medicine. So it is my great pleasure to introduce you to Jeannette Koijane.
Aloha, everybody. Thank you very much for the invitation, and it's, of course, an honor to be sharing the stage with Michelle and, not really a stage, virtual stage with Michelle and Kate and Joy. So I'm very glad I get a chance to just briefly talk to you about what Kokua Mau is doing. So this is me on my 50th birthday. Thank you, Joy, but I'm a little bit older than that. The next slide. So Kokua Mau, as Michelle mentioned before, and Joy, is our state hospice and palliative care organization. It's sort of unique in the country because it's actually quite a bit more than hospice and palliative care. So we are a community benefit organization. We're a nonprofit, and we work around the state. And our members are not only the hospices and health plans, hospitals, but anybody who's really interested in caring for people with serious illness. So we have people who are involved with long-term care, people who are involved with spiritual care, the American Cancer Society, Mediation Center, quite a number of people who are involved with caring for seriously ill people. So for us, it's really important that people with serious illness and their loved ones understand what decisions they may need to make and to figure out where the resources and information are in our community. So that's like the first thing that we do. And I wanted to say, it's always so interesting to look at statistics and try and figure out what's really going on. And certainly, some of our statistics in Hawaii are pretty bad, as Michelle shared, but some of the other ones are actually quite good. And you saw from Michelle the increase in POLST usage. One of the things that we see in Hawaii is that our hospice utilization is the third highest increase in the country for the last 2 years. So we really are seeing that there's a lot more increase in hospice usage, and that data is from the Medicare beneficiaries, which is, of course, the people who are most using POLST. And POLST and advanced directives and hospice. So this all ties together. So we're really happy to see that, and we, try and figure out from the data what exactly is going on. So I did want to say we can also see that there's a large increase in hospice use here in Hawaii. So the next slide, please. One of the things that Kokua Mau tries to do is provide information for free for anybody that would like to use it. So if you can go back one slide. We have a website that has lots of information. Can you go back one slide, Joy? So we have a website that has lots of information. We have a free e-newsletter. Any of you are welcome to sign up for it. You can do so on our website. And we try and then talk about the resources that are available in the state, as well as events that are happening, national resources. We're all about getting the word out and not reinventing the wheel. We have a speakers bureau, so we go out and talk to churches and retired teachers and the Rotary Club, and we're actually right now in the process of expanding that speakers bureau because we're getting a lot more requests. I really feel that we're at a tipping point in Hawaii because a lot of things have been going on now for quite a number of years, including this fabulous work that Michelle and HPH is doing, as well as other parts of Kokua Mau, and certainly Joy's organization at Mountain Pacific. So we're really seeing a lot of increase, so we're expanding the Speakers Bureau. And then, as I mentioned, we have materials that are available for free. So all the POLST material lives on our website, and we really are the keepers of POLST in Hawaii. so that people can download the information there. We have a free advanced directive that a lot of people use, and again, it's in keeping with Hawaii law. That's available, information on CPR and tube feeding. We've just started a project to translate our materials into 10 different languages. Hawaii is a very multicultural place, and as we try to help people with limited English proficiency understand these discussions, we have moved forward with the support of our health plans as well as some of the state hospitals to make those translations happen, and they'll be all available for free up on our website. And then finally, we've been partnering with Kate and the Conversation Project. Michelle also mentioned the starter kit. What a great, thing for the holidays. We're really promoting the Conversation Project as something that you can start upstream rather than starting with a POLST. You can begin with conversations about decisions and what sort of decisions you want. So we appreciate those free resources. Next slide, please. So in addition to helping people with serious illness and their loved ones understand what decisions they need to make and look at the resources, we really try to help professionals do their job better. We have a diffusion method. Rather than creating an organization that's going to do all of this, we want professionals to be doing this. So we have monthly meetings with speakers where we share information about what's going on and work on different projects. We have a bi-monthly clinical case discussion that's called palliative food. So we discuss palliative care and eat food. So that's actually quite a well-attended event, not only for the networking, but also the education. And then we try to jointly sponsor trainings and workshops in our community. So we really try and help people recognize what resources are out there. And finally, the third thing we're trying to do is change the system, raise all boats. We don't do lots of legislation, but we really do look at things that are going to impact everyone. So POLST is a good example. Last year, we spearheaded the coalition to get POLST expanded to include advanced practice registered nurses as signers on the POLST. So we used to be a physician order. Now we're a provider order. And then we also are looking currently at how can we help people find the POLST when it's needed? So we're really looking at this idea of technology in POLST. Can we complete POLST online? Can we create a repository for POLST? How do we link with existing systems like Michelle had? So that's a big job, but it's something that we're working on now. Next slide. I think I've duplicated a slide by mistake, so keep going. So I'm more than happy to answer questions. I was trying to move quickly, and as I said, we really have lots of things that are going on. So we don't control what's going on, but rather make people aware of what's out there, who else is doing things. Don't reinvent the wheel. Invite people in. We really see that our community people look for information in different places, find trusted speakers in different places, and so we really try to pull together people. And so I'm more than happy to answer questions. I would, and encourage people to come to our website or sign up for the newsletter and let us know how we can help you. I do want to say most other states don't have something like Kokua that brings everybody together at one table. And that may be because most states are much bigger than we are, but we recognize the value of having the whole continuum of care represented in one organization. So I know in other states there's a bunch of people doing really good work as well. Okay, there you go, Joy.
All right. Thank you so much, Jeannette. I mean, that's just a snapshot of all the work that Kokua does and that Jeannette does. There have been all kinds of opportunities to work with our payers, with our local Blue Cross Blue Shield affiliate, HMSA, as well as some of the other payers. And it's been a long road, but I think we're really finally getting to a point of critical mass where the healthcare community recognizes that this is important work and that we are spending a lot of money at end of life, and if it's useful, that's great, but if it's not what people want, then we need to correct that. So thank you so much for your presentation, and are there any questions on the line?
Once again, if you do have a question, please press star 1 at this time.
I also encourage you to reach out to whatever organizations are in your state, even if they're not as comprehensive as what we have here. Maybe you can get something started, or start small in your community with the residents, the patients, and the community members that you touch.
Yeah, Joy, I want to say that the California Coalition for Compassionate Care, they're really our model. They have tons of information and lots of webinars and things like that. And, there's POLST organizations in most states, and there's also a national POLST organization. So there are those good resources out there.
Great, thank you.
Okay, it looks like we have no questions at this time.
Okay. I think we're just about at the top of the hour. So in the chat box, I did put my email contact information. If you need anything, please feel free. Also, your QIO representative in your state would have some more information as well if you need the slides or how to access the recorded information and share that with those who could not be on the call today. So I thank all of you very much. Please enjoy the rest of your day, and happy Thanksgiving. And aloha from Hawaii.
Ladies and gentlemen, this concludes today's presentation. Thank you for joining. You may now disconnect